Hi, everybody, and welcome to this webinar presentation, educational presentation for the Advance Me platform, the advancemyce.com. You can log in anytime. You can join as a member and log in anytime and access replays of all the education that we have. We have a webinar tonight with Dr. Kwan Lee, who is a board-certified dental implantologist, practices in Seattle, Washington. He's a diplomat of the American Board of Oral Implantology. He's also a diplomat of the International Congress of Oral Implantologists and a fellow of the International Congress of Oral Implantologists. A very esteemed lot of achievements there for someone who looks so young too. And tonight's presentation is called, Are We Still Afraid of Sinus Augmentation? And as a retired dentist who retired 7 years ago and did less than 20 implants, sinus augmentation terrified the life out of me when I practiced. And so I always referred those ones to someone like Kwan. But Kwan's going to teach you how you can overcome your fears and become competent at sinus augmentation. So Dr. Kwan Lee, thank you and welcome. And if you'd like to share your screen, we can begin the presentation.
All right, thank you, Mike. Let's see. Okay, let me just kind of share this thing. All right, can you guys see the screen?
That's perfect, Kwan. Thank you very much.
All right, thanks for the kind introduction from the David. So today, well, I wanted to welcome everyone, where you guys are logging from, United States or any other workplace. Welcome, and thanks for joining for tonight's webinar on the sinus augmentations. Today's, the sinus augmentations, sinus augmentation is really the cornerstones of advanced implant dentistry, because when we are dealing with the posterior maxillary implant cases, nearly half of the time that we are running into the sinus, and then in some capacity we have to deal with it. So sinus augmentation, it's a really key for any dentist who is planning to do implant dentistry or advanced implant dentistry. It's a key portion of that one. And yes, still I can sense that a lot of dentists are still very afraid of the sinus augmentations. Under the impression that this is something that they're not their territory, so they're not really jumping into the this types of a surgical field over there. So tonight, I'd like to kind of go over the basic, nuts and bolts of the sinus augmentations. And again, this types of a 1 hour, very short, limited time, the webinar. It may not be the complete the education. So please think of this is like a starting point, like a little conduit for your further training and education as you guys continues to expand your surgical skill. Let's get started. So before we start, let me kind of give you a little bit about my backgrounds. My name is Dr. Kwan Lee, and I've been practicing implant dentistry since 20 years, Seattle, Washington, and this is my private practice. And like Dr. David was talking about, I'm currently holding the two diplomat status, one from the American Board of Oral Implantology, and the other from the International Congress of Oral Implantologists over there. And the other thing, I'm a member of the American Dental Society. Let me double check this one here. Can I move my, let me see, screen? Let's see. And also one of the things that highlight of my career would be 2011. I won the first place of the tabletop competition. So this competition it's kind of memorable, and then it means a lot because this competition was chaired by Dr. Karmish. And I hope everyone kind of know who this person is, because a lot of the dentists who study the implant, they study his textbook. So he's one of those figure that, hey, foundation of the implant dentistry. And since then, my journey, and I've been involved with several different implant company as a podium speaker. And ever since that, I love enjoying I love to enjoy the teaching and sharing and meeting other the doctors. Talking about the implant dentistry, for that one. Besides that, I mean, sometimes this is my photo because I'm the main faculty of the something called GDIA, Global Dental Implant Academy. So this is the education institute, most likely the live the implant training in Mexico. So like every years, 3 to 4 times, we go down there, meeting a lot of dentists, and then these are the dentists who wants to get the hands-on the experiences on the live patients. So I think this is a really great platform for the any types of implant surgical dentistry. And after the hard day, then we becomes like a tequila brother who's Don Julio, for that one. So those are the things that we love to enjoy. And one more thing, like I say, this webinar would be a little bit of a starting point. So sometime next year, 2025, May 2nd and May 3rd, Portland, Oregon, I am having the 2-day course of the courses about the total sinus. So basically, this is the courses that covers the didactics and the practice. And basically, this is we teach everything. I teach everything from A to Z, anything about the sinus augmentation, lateral sinus augmentation, crestal sinus augmentation, how to deal with the sinus pathology, anything that when you are dealing with the sinus, then this is the excellent courses. So that if you are whoever are more interested, you can dial down to the later, sometime 2025. You please log into the www.gdia.com, and if you go to the website, then you guys can register and get more information about these courses, for that one. So yeah, let's talk about it. So I know that many of us, us here wants to do sinus segmentations. That's the whole goal. When we're doing doing this the webinar. But not only we wanted to do the sinus augmentation, but we also want to do the sinus augmentation very predictably. So we know the outcomes, so we can kind of design the surgery, so we can how the outcome's gonna be, how the patient's gonna feel. So that's our whole goal is to we want to do the sinus augmentation predictably. And I want to share my first sinus augmentation surgery. I think this surgery was in 2007. During the time, 2007, the most of the atmosphere around the local dentist doing the sinus surgery, it's not really, encouraged. There are this, I mean, a lot of the doctor or specialists think that this types of surgery cannot be done at the local dental office, for them. So they're kind of the adamant about the general dentistry doing the sinus augmentation. But I think the things are changing since the 2007, but still I can sense that a lot of the dentists are still afraid of those kind of sinus surgeries. So I wanted to kind of touch the basis what things are making us to worry about the sinus augmentations. We can kind of overcome those kind of fears, for that one. Since then, 2007, I've done probably well over 700 sinus cases, and plus the implant, along with the implant, the sinus cases with the implants are very high success rate, probably 95, 97%. So if I can do it this much, then I'm 100% sure. So you guys can do it as well. So this is a kind of my experience wise. So let's look at what concern do we have for sinus segmentations. I know, because, coming from the, same background as you, when you think about the sinus segmentations, the first concern that we are talking about is the membrane perforations. when we going through the dental school and then dental training or any types of educations, the perforation is bad. When you're doing the root canal, perforating the roots, when you're doing the cavity prep and then perforating into the purple floor. So anything we know that perforation is not a good thing. It's, for them. Same thing goes with the sinus surgery. So a lot of doctors and dentists are worried about what if the membrane is a perforate. So that's one thing that one concern we have, sinus augmentation, membrane perforations. The other concern that we have it is infections. We know that, oh yes, if there is an infection with the sinus, then a lot of times we are thinking about referring to the patient to the ENT. And if there's infections with the sinus, then it's kind of very difficult to manage it. So that's another concern that we have it as well. And plus the patient's pain and plus the discomfort, morbidity. So a lot of times we're afraid of the patient go through the sinus augmentation surgery and at the end, the patient having a lot of pain and discomfort. So that's one of the fears that the worry that we have it. And plus the sinus pathology such as like a mucocele, mucus retention cyst. So there's some sinus pathology as well. It's a concern that we have it. And plus, any types of medical or dental procedure is involved in some sort of a complication. So out of this kind of a membrane perforation, infections, the patient pain, discomfort, these are all fear factors kind of creating the like an unknown fear. So, hey, I want to do the implant dentistry. I want to do the sinus surgery, but a lot of the doctors or dentists having some concern about these types of stuff over there. So, yes, we want to be cautious, but not overly cautious. So today, hopefully, I can get you, the answers and then get you kind of how to deal with these types of issue, for that one. So today our agenda is we wanna do predictable sinus augmentations, and as well as overcoming the fear and also pleasant patient surgical experiences. Like I say, I'm in private private practice setting, so we have to earn business through the patients. So we're not likely research based, not a university based. So patients, the surgical experience has to be really good. Otherwise, patients, will not refer the patients to to my practice or your practice over there. So we also wanted to create a very pleasant patient surgical experience as well. So let's look at the sinus augmentation right now. So there are only two ways to do access the sinus. One is the lateral approach. Lateral approach meaning that it's coming from the lateral side from the sinus. And the approach would be Crestal approach. Crestal approach meaning comes from the bottom of the sinus, below the sinus, the cavity. So these are only two ways to accessing or the entering to the sinus cavity. So the question is, I get a lot of questions from the other dentists. So how do we decide it? I mean, should I do the lateral sinus or should I do the Crestal sinus approach? So these are the first questions when we are designing our surgery that we have to kind of answer these questions. So before we even make a decisions, let's kind of look at it. What are the benefit and pros and cons of lateral sinus approach? For that one. So we kind of know pros and cons each of the different approaches, so that we can kind of decide which is the best for a patient or each surgical cases. For that one. So the lateral approach, the pros about the lateral approach is it's a direct visualizations. I think that this is a number one benefit of this lateral approach because you can directly watch or see the membrane itself. So this is a huge benefit. So it's not a blind technique. So this is the number one benefit of the lateral approach. And the next thing would be there's no limit for the membrane elevation. For instance, if you need to place the like a 10 millimeters implant length inside of sinus, so I need to elevate the membrane 8 or more, or 10 or 15. So when we are doing the lateral sinus augmentations, there is no limit of how high the membrane we can elevate it. So you can elevate as membrane as high as you want to be. And also the high success rate. Yes, very predictable success rate is very high. And plus the when we have some patient comes with some sort of sinus pathology, infection, sinus, the abscess or the cyst. And with the lateral approach, we can correct it. We can remove those types of the sinus pathology. So those are the main pros of the lateral sinus approach. The minus, the con would be the invasiveness. Yes, as you can see, as you can picture it, we have to create incisions, reflect the flaps, make the window. So it is involved with a little bit more invasive surgery. But I think that to me, that invasive surgery, it's really depending on the subjective what you've been doing. If you're doing the full mouth reconstruction implant surgery, then sinus surgery, it's not that invasive. But if you are doing single tooth implant dentistry, then yes, sinus surgery would be invasive than your single tooth implant dentistry. And the other, the con would be the membrane perforations. So yes, any types of sinus surgery would be will involve some sort of membrane perforation. Really doesn't matter how many times you've done it, 1,000 times of the sinus surgery, 10 times of sinus surgery. Sometimes this membrane, it just happens. So the bottom line, the more important thing is how do we manage those perforations? I'm not so sure if we have a time to go over how to manage the perforations, but certainly in the future, the education courses such as in next years, that I can kind of show you and teach you how to manage the membrane perforations. And plus the minus would be, yes, it requires a little bit more surgical training as well. And the other method would be Crestal approach. The Crestal approach would be, since the lateral approach coming from the side, it involved a lot of surgical, the invasive. So Crestal approach involved the pros would be less invasive. So comparing to the lateral, we are only accessing the sinus from the bottom of the sinus cavity, and then we don't have to make a huge flap. So it is less invasive. And also the chances are the complications are very low at this time, because many of the Crestal sinus augmentations, the complications would be just the membrane perforation. Other than that, not much, for that one. And the other benefit of the Crestal sinus approach would be shorter procedure time. So this is a lot quicker and faster comparing to the lateral sinus augmentation. So that would be the pro and the good things about the Crestal approach. However, there's also some cons. So the minus would be, one thing would be it is a blind technique. So this is the number one thing that I don't like the Crestal approach, and yet I'm teaching both of them. The Crestal approach is a very blind technique. So when you are elevating the membrane, you can't really see the membrane. So you have to kind of rely on or you have to take some faith that, you are elevating the membrane. But the bottom line is you really don't know whether you are actually elevating the membrane unless you are taking the X-ray. And sometimes you're not even sure there's some sort of micro perforation as well. So the blind technique is a huge minus of the Crestal approach. And also sometimes it is very technique sensitive, because some doctors have a very fine tuning about the hands. Some doctors are not. So sometimes it takes some practice to elevating the membrane through the small hole. Sometimes it's not that easy. So it's sometimes technique sensitive as well. And plus that, then it's also membrane dependent as well. Some membranes are very nice and healthy, resilient. So no matter how hard you're pushing the membrane, it doesn't get perforated. Whereas some membranes are very thin, almost like the eggshell membrane. So they are very fragile. So even if you are touching even very gently force at all, fluid, and still you may get some perforation as well. So sometimes becomes the membrane dependent as well, fluid. So those are the generalized pros and cons, lateral sinus augmentations and Crestal sinus augmentations. So to go back to the question, so how do we decide it? So, I mean, it really depending on your surgical level, but these are some guidelines that, for you to decide, hey, this case would be better to do lateral sinus augmentations. So the number one thing, the guideline would be the membrane elevation height. So if you say, again, you're placing an implant tooth number position 14, upper left side, and if you need to elevate the Schneiderian, the membrane 4 mm or above, higher than 4 mm, then probably the lateral sinus augmentation would be best options or recommended. And plus, when you look at the patient CBCT, so cone beam X-ray, if their residual bone height is also a good one of the factors to deciding whether should I do the letter or should I do the Crestal over there. So that's also a good decision, one of the decision factors. And the other thing is a membrane integrity. So membrane integrity, you can really tell from the outside from the patient's mouth. You will have to take the cone beam CBCT X-ray. Once you take the X-ray, and then you can kind of look at the membrane integrity. So what we are looking for, if there is any kind of the sinus pathology, such as the thickened sinus membrane, if there's any kind of a cyst or the mucocele or retention cyst, those kind of any kind of pathology are present in the sinus, and those are the one that has the membrane integrity is very compromised. So those are the types of that if you are doing Crestal approach, then sometimes you get the outcomes are very unpredictable, and then has some perforation over there. So these are the how do I deciding the what approach should I take it, for now. So you can kind of, it's not a single unilateral decisions. You have to kind of combine each factors, and you have to kind of weigh which one is best for the patient. So those are my main recommendation. How do we decide letter or Crestal? These are my recommendation as well. So before we doing anything for sinuses, the augmentations, the cases, let's take a look at the CBCT sinus evaluations. So when you look at the patient's CBCT, this is the first thing that you're going to looking at their X-ray. So one is looking at their residual bone height. If the residual bone height is very thin, and then you're probably gonna have to use the amount of the membrane elevation is very much. So you will have to lateral sinus augmentation. If your the residual bone height is somewhere, some 3 to 4 millimeters, then also you have to think about which direction should I go. So the residual bone height is a main one of the key factors. But I wanted to introduce this guideline. This is, I think that this guideline was published by Review 2023. A lot of this information, yes, it may be the redundancy, or people already know this information, but I think that this guideline is really clearly kind of guide you didactic wise, guide you what types of sinus surgery that should I do it. So when you're looking at the maxillary sinus floor augmentations, if you're looking at the residual bone height is 6 millimeters or above than 6 millimeters, then usually it's a Crestal approach would be best options, because if you have a 6 millimeter residual bone height, then you're planning about 9 millimeters to 10 millimeter implant the length, then you only have to increase or to elevate 2 to 3 millimeters of membrane, which is very predictable with the Crestal approach. So that's why that's recommendations. If you're say the residual bone height is between 4 to 6 millimeters, then still manageable, negotiable. You can still negotiating the elevating the membrane with the Crestal approach. But sometimes when you have this types of residual bone height, there are some sinus disease, such as like a thickened sinus membrane, like a mucocele, and sometimes retention cyst. So any types of sinus disease, then you cannot really negotiating through the Crestal approach. So they're recommending lateral approach over there. So if you look at this ones one by one, it'll give you very clear didactics what types of surgery that should I be doing, for that one. So this is one thing that I just want you to take away for today's webinar. Whatever you do, take a pictures, screenshots, and this will give you the very nice, good guidance. And then as well as this X-ray, the cone beam CT, CBCT, give you the nice, good representation of each of the case, like a case number 1, that corresponding to the case in scenario number 1. So these are the types of a CBCT. You have a good residual bone height, 6 millimeter or above. And these each types of the cone beams, and then this is number 3, and it corresponding to the number 3 cases. You have some residual bone height between 4 to 6 millimeters, but as you can see, there's just some radiopacity, and they're also kind of suspecting some sort of a sinus cyst or some sort of a sinus disease is present. Then you can kind of leaning towards doing the lateral approach over there. So these are the good the didactic representation of what types of the sinus surgery should I be doing. So those are the ones that I really want you to take on, for that one. So let's get to dive into the cases. So this is the more likely people would be interested, and let's spend some more time with that one. So I wanted to share 2 cases for tonight, and first one is a very standard lateral sinus case. This is a very straightforward textbook case. So not much of the complications. So this one would be, for those the doctor who haven't done many of the sinus case, this will be very, standard textbook case over there. Couple of things that I wanted to bring it out: incision design when you're doing the sinus surgery. So think of what you're going into the patient's room right now. So you have to think about the incision design. And then making the lateral window location. Where do I make my sinus lateral window? And how do I make the lateral window? So there are different ways of making a window over there. And the other thing, the question we also want to do is a graft material. What types of bone graft should I placing or depositing inside the sinus? The lastly, but not the least, is a PRF utilization. So PRF stands out for platelet-rich fibrin. So this is a bioactive material that harvests from the patient's own venous blood. So it's 100% autogenous. So it's really good any types of sinus surgery or any types of implant or surgical dentistry. So we can kind of go over this time to later times, for that one. So let's look at the first thing over here. So first thing would be patient walked into your office. This is your panoramic X-ray, and patients need the interest in doing an implant upper left side. So this is the panoramic X-ray. Panoramic X-ray is not a the complete X-ray. Right now, I think I strongly advocating that when you are doing the sinus surgery, then I think you should have a cone beam CT, CBCT. But this still panoramic X-ray give you nice, good information in terms of the sinus, the size-wise from interior borders and the posterior borders, front and back side of how long is my sinus over there. So this kind of give you the reference points over there. And this is the first the patient's photo when you walk into your office. Patients missing the upper the upper left side teeth for a long time. So this is where the missing teeth around the area. So you can remember, burn this picture in your mind. So when you're actually doing the surgery, then that to give you the good guide as well. So first thing is, so now we wanted to create the incision. So basically, the first thing that we want to do is sinus surgery. The incisions are very simple. It's a very straightforward. One single Crestal incision here, and it's also one single vertical incision right here. Most of the time, when you are doing the sinus surgery, then you are going to do 3 incisions. One is a Crestal incisions, and then the other one is a vertical incision here, and the vertical incision over there. Once you create those kind of incision, then you are going to do the full thickness membrane elevation, or full thickness flap, reflecting the flap. Once you reflect the whole flap, then you can kind of see the anatomy of the upper jaw, especially around the sinus. You can see the bone it's bulging it out, protruding out like a, like a dome shape around this area. So then you know that that's the area that's sinus. So once you reflected the flap, then you can see these types of, and then that's the most likely the centers of the sinus cavity. So this area, so now we need to create the letter, this window, because through the window, we're going to elevate the membrane, also depositing some bone, for that one. So when you think about making a window, we wanted to make the window not too much position towards the front, not too much position toward the back, because then there will be a very disadvantage for us, because we wanted to make the window somewhere in the middle so that we can access through the front side of the sinus or the back side, and also superior border, and then also inferior borders around the area. So this is your target area, where you are making the window, which is corresponding to the right around the center of this convex shapes, the bone anatomy. So this is the window is created. So this window, the size of the window, it's kind of, I mean, for me, there are different variations. Some doctors are making this window huge window, almost like you can go through the whole, like a truck, for them. But for me, I don't want to make the window that big, because I want to make the window just enough to introduce my instrument, so that I can elevate the membrane without tearing, but still small enough that this surgery is very less invasive than conventional or the other sinus surgery, for that one. So we want to make the windows. This is about dimension wise about the 5-6 millimeters for the heights, and then width would be depending on the how. It could vary depending on how many implants that you guys are placing it. Then I can increase the width of the window towards the posteriorly and the anteriorly. So the question is, how do we make the window? There are different ways of making a window, for that one. So one way to making a window is this method, which is the piezoelectric machine. So piezoelectric machine using the specific proprietary the component of the like a cavitrons, it vibrates these types of tiny the metal saw instrument and creating a small cuts. The benefit of this piezo machine is it only cuts a hard tissue, so it cuts a very hard surface like a bone or teeth, something hard tissue, for that one. But it doesn't really cut any types of soft tissue like a soft tissue like a membrane and the flaps, those kind of stuff. It doesn't cut it, so it's very safe. And plus the gap, when we create a window, the cutting gap is very small. So many times this window can be repositioned back to the where it was cut it out over there. So that's the good benefit of the piezoelectrics. The other types of the instrument that you can use it is a high-speed handpiece. So we are using the surgical burr. We are all the dentists. We are. I don't know, it depends, but how many crown all of you guys have you, grind it down, cut how many crowns, for your entire, dentistry. It's a lot, more than hundreds and thousands. And then each time we preparing the crowns, we are using some sort of the margins, such as your shoulders, champers, and those types of margins with the burr. So if you can do it, those kind of crown margin preparations, then yes, you can make the sinus window with the surgical burr. I just don't want you to use any types of a very thick burr, such as the 701, 702, like oral surgery, third molar extraction cutting burr, because when you guys are using those types of a large burr, big burr, when you're creating a window, then there's not much left over. Then you're just gonna have a big hole over there. So I rather use something called this types of small burr. These are I think the micro copy, if you wanted more information, then I can share it later. But it's a surgical board is a very tiny, small size, so you can make the window as much as small as the the piezoelectric machines. The other machine, the instrument you can also using this types of a diamond burr. This is a bone planing burr. So basically, it's grinding it down the whole sinus window. but to me, I'm not sure, but I would not use it at this time because once I make the window out of this burr, then you don't have any window to put it back there. So you have to cover it with something else, such as membrane or bone graft material, for that. So this one's, I mean, yes, you can use it, but for my surgery, then I will not use this types of bone planing burr, for that one. So these are the main types of the method or the instrument you can use those kind of window. So once the window is made over here, then you can double check the integrity of the membrane so there's no perforations. And the elevator instrument, I wanted to share a little bit about video clip. So because many times when you get a window, the membrane perforations, it's when you make the window and that's one situation that you make the perforation, and the other the case here to be initial membrane detachment. The elevator instrument here, I'm going down. So right now, if you look at this video right there, then with the instruments, I'm very gently, leveraging on the bone instead of actually touching the membrane, gently lifting the membrane away from this area. So that's the initial membrane detachment. So once you take your time and then do the initial detachment of the membrane around the window, then the rest of the procedures are very easy to follow, and then minimize the chance of the perforations. Reflecting the membrane, my instrument is staying on the bone. Okay, so that's very. So once the initial detachments are done, then you can continue to working around the membrane. Because if you make the window too low, too high, then the movement's going to be restricted. You see what I'm talking about? This instrument has a certain angulation, so you're not staying inside the angulation over there, okay? So that's what the things over there. So right now, as you can see, the membranes are pretty much well separated from the sinus cavity, and then as the patient's breathing, you can see the membrane is up and down. That's a beautiful sinus. So that's a beautiful sinus, and then now we are ready to. I'm putting. So this is the part, once your membranes are nicely well separated from the sinus cavity. So this is the first thing that I like to introduce. This is called something called PRF. So basically this PRF is a biological enhancer harvest from the patients. It works like a little jelly, little cheese string. And this will give you the, excuse me. It'll give you the serve as like a little buffer, so a little bit of a barrier between the graft material you're putting it in against the sinus membrane. So this will minimize any types of the graft material scratching the membrane and then poking the membrane and then making any kind of micro perforations. So this PRF will preventing those kind of stuff over there. So you're gently introducing the PRF membrane. I mean the PRF inside of the sinus. And once the PRF is inserted inside sinus, then you can put those sticky bones. So basically, this is the particularly the bone graft material mixed up with the PRF plasma. It becomes very sticky. So the benefit of this one, the handling of the graft material is just so good. So you can place the graft material where you want it to place you want to place it. So by doing this way, you can avoid like a graft material dusting it up whole inside of the sinus cavity. So and also you can focusing the where your graft materials are positioned, where you want it to grow most of the bone inside of sinus. And once you've done it, then you can repositioning your window back to the place. So this is a good way to closing it. So that as you can see, this membrane, I mean this. So this, window, the harvest window goes back to its place, and all you have to do just covering the membrane as well.
So can you give us extra protection for the window?
So,
It's kind of
so the next question is, what kind of bone graft material are we depositing inside the sinus? So for the sinus, I mean, they will not really differentiate any types of a bone graft material. So they can, you can do allograft is a good types of bone material, as well as geno, as well as alloplastic, which is a synthetic bone, and plus the PRF. Um, so you can mix and match allo and geno. The benefit of the geno is would be it has a longer resolution time. So even the graft materials are placed a long time, and then this will keep up the volumes of the graft material longer than allograft. And sometimes, again, this is something that we can discuss the longer format of the sinus education, the training. Sometimes I can only put a PRF membrane only for as a graft material. It also minimize any types of a sinus infection as well. So it's also very successful. So over there. So these are the main types: allos, xenos, alloplastic, and PRF over there. Once the membrane is successfully the elevated and then graft material introduced, then you can replace the window around this area, and once the window is replaced over there, you can cover it with this PRF membrane, and you can do the finishing with the primary closure. So this is the day one, post-op day one. As you can see, 3 implants are placed at the same time of the sinus graft, and plus the PRF, plus the particular graft material. And as you can see, the elevation of the membrane, I'm recalling my memory, probably like a 12 to 15 millimeters above the floor of the sinus, for that one. So that's the 0 day one. And that's about 3-year post-op, the X-ray. As you can see, a lot of the graft material that we put it in, it becomes resolved, they get resorption over there, which is normal, because when you're adding the graft material inside the sinus, then over the time those materials get resolved over there. So this is the one thing you want to see after the several years later, sinus graft augmentations. One thing that I want to point out of this ones, when the sinus augmentation nicely done, then you will see something called recorticalized bone. So if you can see, look at the sinus floor over there. Before, there wasn't any types of a cortical layer, but now after the bone graft and after 3 years, then the graft materials are being pneumatized, being air pressure from the inside, the outside of the sinus, and then it's condensed to the bottom of the sinus floor, and it becomes nice, good corticalized bone layer. So this is a good, successful sinus bone augmentation. So this is a very standard case of sinus bone augmentations with a lateral approach, for that one. And before and after. So right now looks like we have about 15 minutes. So let me kind of go over quickly. The other approach would be Crestal sinus augmentations. Unlikely the lateral sinus augmentations, Crestal sinus augmentation is less invasive, and then most of the general dentists can easily accessible doing these types of surgery. So but the Crestal sinus augmentations, there are many different ways you can do it. One of the way is using the osteotome. In 1994, Dr. Sumner first invented this osteotome technique. So basically using the mallet, and then we are breaking through the sinus floor, the bottom of the sinus floor, and then using the small hole, we introduce the bone graft material that will elevate around the area. Over the time, people evolve, and then they want to try using, hey, can I use a piezo machine, and then using the water. Sometimes people using the balloon techniques. Sometimes people using also the pH from the water, like water pressure from the pH machine. That's also sometimes used for that one. And the latest, the development would be the machine-driven sinus augmentations. I think the Versa, the osteodensification technique is also used for the sinus, the Crestal sinus augmentations. I kind of try this kind of each of those, but lately I came down to one method of using the water pressure, hydraulic pressure, because each of the different types of sinus augmentation has a pros and cons. One of the minus would be if I using the osteotomy technique, then I have to hammer the patients. Sometimes that create a very unpleasant experiences. Even though I'm gently tapping the instruments, patients still remember oh yeah, doctor, you remember that you're kind of hammering my inside to my head, for that. So that's they kind of remember, for that. So I'm kind of shy away from the osteotomy technique. And I also tried like a densifier machine driven Crestal sinus augmentation, but all this Crestal sinus augmentation method has some limitation because it can only deliver to results about 3 to 4 millimeters elevation, or the bone graft membrane elevation over there. So there are some limitation over there. But the method that I'm going to introduce, you can elevate the membrane as close, like even 7 to 10, even higher, that the comparing to the regular Crestal sinus augmentation, it has a the ability to elevate the membrane much higher without more also predictably as well. So let's take a look at the case for that one. So this is called, I usually call closed hydraulic Crestal approach. So basically, in a nutshell, this patient's having the failing bridges, upper left side, tooth number 13, 14, 15. This is the X-ray. As you can see, the root canal is becoming a failure at this time over there. So this is case the patient need an implant. And this is a CBCT when we're looking at the patient. So when I'm looking at the CBCT, I know that the residual bone height is not that great. So in order for me to elevating this the sinus membrane, I will probably gonna have to use a lateral sinus approach. However, this patient is a female, and this patient has a very severe TMJ issue. So she could not open her mouth that wide. And also she can hold her mouth she cannot hold her mouth open that long time either. So even though the clinical situation is indicated for the lateral sinus augmentations, for patient factors, I cannot do lateral sinus augmentation. So I had to do the Crestal approach, but I need to elevate the membrane high enough so that I can deliver the good size of the implant length. So this is the types of the cases that regular traditional Crestal approach is not appropriate to elevate the membrane up there. So that's why I'm trying to show you how can I do this Crestal sinus augmentations in these types of cases when you have to elevate the membrane much higher. So those teeth are extracted as well. And this is the instrument that I usually using it. So this is the this instrument is made by the dentist. This is the implant company that I am using it. And they have the sinus kit that has this types of the specialized proprietary tips. It's called something called aqua tips. So what is special about this one? It's got a little thread inside. So when we drill the sinus floor from the bottom, this special burr, this burr is match the size of this the 2.8 the aqua tips over there. So once you drill through the sinus from the floor, this tip is inserted and then it actually screw down to the inside of the floor. So it create a watertight seal from your sinus. So here, like I say, when you do the immediate implant placement, and then when you are doing the Crestal approach, most of the types conventional method is very difficult and it has a limitation, but this method doesn't have that much of the limitation over there. So once the teeth are nicely removed, and I was drilled through this with this, the specialized rimmer or burr. And as you can see, this specialized tip, aqua tip, is screwed down into the extraction side. So now I am communicating into the sinus and using this kind of a syringe. So remember, I was talking about the one of the most the minus of the Crestal sinus is it's a blind technique because I can't see the window. I mean I can't see the membrane, so I have no idea whether the membrane is perforated or is intact. But with this method, I can get the real-time feedback of the membrane is intact. So take a look at this video. So I'm pushing the saline through the hose, through the tip. So now we have a pressure sealed in through the syringe, through the sinus. So as long as I can push it and I can pull it, push it and pull it, that is the indications of the membrane is not perforated. So you can get even though the Crestal sinus augmentation is a blind techniques, by using the closed hydraulic system, I can verify the membrane is not perforated. Plus, the amount of saline that I can inject through this system, I can kind of control how high the membrane that I can elevate it. So if I'm putting probably 7 to 10 cc, then I can elevate the membrane as high like a 7 to 10 or 12 millimeters high up. Once the membrane is elevated, then we are introducing the autogenous material, which is the PRF. Because again, I don't want to introduce too much of the bone graft material. Still, there's some chance of the micro perforations. So if the membrane gets perforated, then this types of bone material, it will spread inside the sinus. So I wanted to minimize. So I want to use as much as possibly the autogenous material, which is the PRF membrane around this one. So those PRF is inserted inside the Crestal. And then I'm doing this second side of the membrane elevation. So first side was this one, and then I'm doing the second side of the membrane elevation using the closed hydraulic system. And this is the cone beam CT before and after. So before, this is where the patient had it about, let's say 3 to 4 millimeters, but I wanted to elevate the membrane way up here because I wanted to place the regular size of the implant. And as you can see, cone beam CT, this is how much we elevate the membrane, about 13 to 14 millimeter up high. And once the membrane is elevated around this much, then we can introduce the autogenous, the patient's graft material, PRF, and a little bit of bone graft material. And once the membrane and sinus membrane is elevated and graft is done, the rest of the extraction sites are typical bone graft procedure. So graft materials are placed inside of the extraction site, and then those membranes are covered around the area. and typical the primary closure. And this is the about 5 months after the crown is delivered. I'm still following the same patients. I think that's the patient, when usually patient, they don't have any problem, then they don't usually come to the dental office that often. So this is the most follow-up that I got about 5 months post-op x-ray. But I'm trying to track it more down here. But in this type of case, this types of the closed hydraulic Crestal sinus augmentation, it makes sense. In types of case that you will have to do the lateral sinus augmentation, but sometimes you can do that whatever the reason, patient factors, whatever the doctor's surgical comfort level, then you can use these types of Crestal sinus augmentation to delivering the regular lateral sinus augmentations elevation for that one. So these are the two main things. I mean, of course, we like to discuss more of this surgical procedure, but like I say, this is today's given the hour, 1 hour. Please think of this is as the starting points and conduit for your further education training. But a couple of things I wanted to introduce is the autogenous material PRF. It's a good way to the grafting the sinus inside. And then this types of the Crestal sinus augmentation, closed system hydraulic Crestal sinus augmentation. It's a good way to elevating the sinus membrane. Plus lateral sinus augmentation as well. I'm a huge advocate for the lateral sinus augmentation as well, because no matter how well the Crestal sinus is working, sometimes you do have some perforations and then some, the complication. So you will have to access sometimes due to the sinus, through the lateral sinus augmentation, lateral approach as well. So thank you for tonight's for joining tonight's webinar. I don't know if anyone has questions, anything. Maybe I can answer it. If not, then I can share my contacts later. Then you guys can reach me out to. I'm pretty much discoverable from the Google. You can Google my name, and then usually my practice and the informations are come up with the Google search over there, so you can discover as well. But other than that, I think that this will be the end of tonight's webinar about the sinus augmentations.
Dr. Kwan, we can open up. We have a couple of people still on. If they've got any questions, they can write them in the chat, or they can unmute themselves.
Yeah, great.
But if not, we'll certainly display your contact details associated with this on the Advance My CE platform, so that you can get inquiries. Certainly, your presentation was eye-opening to me, as well as sinus opening, to see how avant-garde it is now for people to just go into the sinus and augment the sinus, so that we can utilize that space, fill it up with usable foundation, and give people some teeth in places where they never had them before. And that's really important, as opposed to having to send them down the denture and full denture road. This is a real godsend for them. So thank you for the education. If anyone's there with a question, if not, then further questions to Dr. Kwan Lee via his contact details on the Advance My CE website.
Yeah, so I think that if someone has more questions and then discuss the case, then I believe that your website, the Advance My CE, the website has the informations, so they can reach out to me.
Perfect. Well, Dr. Kwan, let me just pause the recording here.